All right, welcome to the Place of Service Question and Answers webinar. Our goal for this is to provide you the opportunity to ask questions and to get them answered. I will tell you we did get quite a few of pre-submitted questions, which are actually part of your registration process and always a recommended way to send in questions. I'm Tom Ryan. I'll be your presenter today. Today, I'm joined by Leanne Foster, who's going to help with some of the question and answers, and I'm also joined by Ashley from our team. Now, Ashley and Leanne will be on the chat for you and available. And then again, it's speaking up as they have things that come up or they have input to add in. We did have several questions that came in about Medicare Part C or Medicare Advantage plans. We cannot address those questions. Medicare Advantage plans are a separate contract for CMS. We are contracted to process traditional Medicare, fee-for-service Medicare, Part A and B claims. We are Medicare administrative contractors for Jurisdiction 5, Iowa, Kansas, Missouri, Nebraska, and for Jurisdiction 8, Indiana and Michigan. As part of those contracts, we also do have some national providers with home offices in those states, so they're across the country. But keep in mind, we can't answer questions related to other contractors at all. This would include other Medicare administrative contractors or other Part C plans or Medicare Advantage plans. So if that's why you're on, I'm going to apologize right away and say this might not be the webinar for you, and you might not want to stay on the whole time. Just letting you know, so that way you're not spending time with me that you don't need to be spending. A couple of housekeeping things. There is a presentation that goes with this. The presentation is available in our training center in the live events page. I'm going to have the live events page posted for you in the chat. Now, the live events page offers the opportunity to register for an event or to download materials for that day. We do typically try to get things posted around 5 days before the event. Usually that's going to be Thursday or Friday before the event. But keep in mind, just because the event's over and we've removed it from the live events page because it's no longer coming up, we don't remove the material. What we do is hold it for a minute and then we'll repost it when we post the encore presentation. So we do have that coming. The encore presentation is posted on the encore presentations page within the training center, and the material will be available for 60 to 90 days. It just depends on the number of presentations that we have at that time. During this session, we have a lot of registration, a lot of people registered. So we decided that we would not take open mic questions. We're going to do them all in chat, but that doesn't mean you can't add a question. Please feel free to add a question at any time in chat. I'm going to focus on getting the ones that were pre-submitted, the people that took the time to send those questions in via the registration process first, and then should time permit, we will go to the live questions. As always, we do ask that you do provide feedback on this event. That is part of our information and gathering. It's also part of what CMS looks at for us. We want to make sure we're hitting what you need from us, so please make sure that you provide any feedback that you have via the survey. The survey link will be available after the event. A couple of things to keep in mind. This tool, this education, this tool is for you, and it's to assist the provider community. The Medicare rules and regulations do change often, and as they change, we do have to keep up with them. So as of today, what we have is current. Now, keep in mind that could change in an hour from now, that could change in 5 minutes. We've all been through that process, but we're going to give you the best information that we have. The answers that we're going to give you are based on what is current today, but also based on the facts and the questions. We do have some questions that came in that were a little vague, so I'll give you the best I can, or what I speculate or what I believe with my 20 years of background experience as to what you're asking me. Now, remember, Medicare rules will always determine final coverage. So if you need clarification on a question, if I don't answer your question, if you were the one that submitted it, but you don't like what I have to say in terms of I didn't give you enough detail or it's not going where you need it to go to get you what you need, got to put it back in chat. I don't know otherwise. Always, though, remember that the CMS website will give you the most current regulations, rules, and findings, and this does include place of service, and we are going to look at the internet-only manuals. In other words, the Medicare Claims Processing Manual that will list this instruction for you. So please make sure you're using the CMS website for the most current and up-to-date information. What are we going to do today? Well, first, we want to provide you an understanding and answer your questions regarding place of service to avoid errors. Place of service is commonly billed on the CMS 1500 claim form or 837P electronic transaction. We did have some questions come in about a UB04 or 837 I electronic transaction, they do not use place of service, they use type of bill. And we're going to talk about that in just a little while. So when we use the term place of service, please understand it's a 2-digit code on a 1500 claim form or an 837P electronic transaction. We will define again what place of service is. I will show you some resources to kind of help you out, especially the internet only manual. And then we're going to move into question and answers. My presentation should not take the full hour at all. And the question and answers are built into it if you've pre-submitted a question. Let's start off with just the basic definition and get into that basic point so that you have an understanding of what it is. So again, the basic definition, a place of service is a code that is appended to a CMS 1500 claim form in a 2-digit code, and it identifies the location of the patient at the time of service. This same code is also used in the 837P electronic transaction. These are your professional transactions. All claims submitted must have a place of service. Now on a UB04 837I, you will use a type of bill. It represents where the service was done, if the service was inpatient or outpatient, and also if the claim is a single claim, if it's beginning and ending claim. It will also represent if it's a middle claim or a part of a series that isn't quite done. It will represent a discharge claim as well. So there's a variety of different things that can happen with that type of bill, and it is a little bit different than place of service. So if you're going to ask me a question and you are saying, I'm not really getting the answer that I need, please make sure that you're specifying. Are you trying to talk about type of bill, or are you trying to talk about true place of service? Questions submitted, I will talk about from the perspective of true place of service, which again is 1500 or 837P, unless you ask me otherwise. Otherwise, I don't know for sure. So again, this is the representation of where the patient is at and where the service is physically being located. And we'll talk more about that in just a few moments. We were asked to start with, what's causes or why is this important to understand? And the key thing I think really comes down to the incorrect place of service can actually lead to an incorrect payment. For some place of service, there are a facility and a non-facility pricing. So an office would get paid differently than an outpatient hospital claim. Even though they're both outpatient services, the office gets overhead, the outpatient hospital does not, because the outpatient hospital bills for that and gets overhead on their claim versus the professional. The professional would bill for an outpatient hospital. That is correct, but they would bill an evaluation and management code. They don't get the service charge, or they don't get the facility charge for that. Okay. It can also affect things like global versus professional technical billings. So can I bill this globally, or do I need to do a professional technical billing? Now, someone asked me how that works, and the reason that this was put in, I'm guessing you guys were looking at my slide when you got that one because we just got the question. But what I'm saying there is, for instance, inpatient bundling can affect place of service. Are they inpatient when you see them, or are they outpatient? Let's talk about skilled nursing facility for just a moment with this one. If they're inpatient for a skilled nursing facility, there are certain services that must be billed back to the skilled nursing facility. That place of service is different, and we're going to define that because you did ask that, and I do have a very specific slide built in to give you those too. But there are also times when the inpatient days are used up. It's still medically necessary, but you must change your place of service to reflect to Medicare that this bundling concept doesn't apply anymore. So that's what we're talking about when we talk about global versus professional procedures. Again, it's the same procedure code. It's just, can you bill it globally, or do you need to break it into a TC component? Ancillary staff is just another example that can be affected by this. And the reason that that one came up was more regarding incident 2. So your question was, can incident 2 be billed in all places of service? And the answer is no, definitely not. Incident 2 has a very specific set of place of services. For instance, an office 11 would be an appropriate place of service for incident 2. Also, the administration of injections, that was literally the question that I got on that one. So if you need more on that, help me out, but I'll kind of speculate maybe a little bit here. So what happens is, depending on the injection and what it is for, so if it's a vaccine, if it's certain things, there are certain services that do need to be billed back to a facility if they're in that facility. If they're not in that facility, they would be billable outside. Also, the administration of an injection could be at a retail space for something like a vaccine. So I think that's where they were going with that question, but I'm not really sure with just the term administration of injection. So based on the other questions, hopefully I'll get you your answer. And if not, I do need you to put a little bit more information in the chat for me. Okay. Let's move on from there. Claim location. This must be applied to all claims. As I said, it does go into certain loops. The loop requirements are listed here. For those of you that bill electronically and say, I don't know what you're talking about with this loop and segments and all these different things, no worries. What you do is put it into your computer system. Your computer system translates that in your programmer's language. You don't have to do it yourself. But for a CMS 1500, this is in item 24B, and it does have to be there, and it is a 2-digit code. So we want to make sure you have that in the correct item. If it's not in the right place, this will cause an unprocessable. So for a paper claim or an 837P, if it's not where it needs to be, we can't do anything with it. We can't even process the claim because that's how basic it is. For UB04, it's in field locator 4. This is your type of bill. And again, if your type of bill is not correct, or if you don't have the right digits in there, because again, a type of bill is 3 versus 2, and someone asked about the leading 0, yes, we assume the leading 0 is there. Type of bill always starts with a 0 and then goes like 1, 1, or has, a variety of difference. So please make sure that you put the leading 0 there. It's just a requirement, an extra space filler. So hopefully that gives you what you needed for the claim location. Again, on the 1500 or the 837P, this will cause an unprocessable. We can't finalize the claim. On a UB04 or 837I, it's going to cause a return to provider. We can't process that claim either, but it's different terms. You got to fix it and either resubmit it or fix it and put it back through the system. So return to provider puts it back through the system. So with that, that's the information I wanted to provide, just kind of some general information, get through some of those general questions that we had. I would like to move through just a couple of resources to help answer some additional questions. Now, these resources are going to help you locate some additional information, and they're very important resources. So we want to talk about these to get started with. So Medicare Claims Processing Manual, if you are not familiar with this, I do recommend that you get familiar with it. It is available on the CMS website. It is part of the internet-only manuals. These are your day-to-day operating instructions. And we are going to take a look at Chapter 12, and then we're going to look at Section 20.4.2, and then we'll come back and look at Chapter 4. So the big one is up here, and it's going to be Chapter 12. So CMS website, cms.gov. It is part of Medicare. So you need to select the word Medicare, come down to regulations and guidance. And some people get a little confused. They think it's going to be under coverage. It's not. It's regulations and guidance, and it's manuals. The reason for that is, again, these are your day-to-day operating instructions. Your coverage section isn't about that. It's something completely different. Internet-only manuals here. Once that opens up, we're going to scroll down. You will see a publication number, which will be the link, but then you'll see the title. And as I said to you, it's the Medicare Claims Processing Manual. And when you're in the Medicare Claims Processing Manual, I'm going to tell you, don't forget any of the other sections that may be applicable to you, but we're going to scroll down for a hot minute here. Keep scrolling. There you go. See down here, you get Chapter 25 and 26. Type of bill information would be in 25. Claims processing place of service would be in 26. And of course, I forgot 10.5. Sorry, there it is. It's 10.5. If you select that, it'll automatically move you through it, and it's going to read through this information. One of the reasons I really did want to bring you out here is we did have some very specific questions. And I do have questions for you later, but I do have some information to help now. So first, you asked about the payment differential. It is defined for us. We do not define whether you get a facility or a non-facility payment based on this place of service code on a 1500 claim form. CMS does this in the internet-only manual. It is the payment rate column within this section, and every single one of these does have something that will help indicate. Now, there are also ones that will tell you not applicable. So if you put this on a claim, the claim will either become unprocessable automatically. We can't do anything with that. It's not applicable. You can read the special circumstances below, and I do recommend that. So just scroll down through here. Hopefully everyone is aware of that. This is probably one of our most common ones, most common ones. 11, which is for office, and that's a provider's special provider's area that they're paying for. So it could be their own building, it could be a suite, it could be a section of a hospital, section of a skilled nursing facility. The key thing is the provider is actually paying for that office. And I want to keep going down just a little bit. I apologize. What I'm trying to get through is that special circumstances, which of course is at the bottom of this section. So look away if this is bothering you, and I do apologize. All right, here's the special consideration. One of the big questions we got, we do have another question for this, is special considerations for telehealth. What are the codes for telehealth? 2 and 10. That's what you got. CMS has made it very clear right here that we only use 2 and 10 unless, okay, so what's the unless? And we'll go through this again, but unless it's an audio only, then audio, video. Okay, but it doesn't change the rates. If there's certain things you need to know about that. So we want to make sure that we're aware of where this information is coming from. And I'm using this specifically for this example because there are other different situations where you could actually read through some of these different types of things for you. Okay. So I do recommend that if you're not familiar with the special considerations and something here does apply to you, it is time to really take a minute, read through it. But otherwise, I do want to get back on track here. So we'll jump back to our PowerPoint. Chapter 4, Part B, hospital is include inpatient ops. This is just about the billing. So if we wanted to go back, and I'm sorry, I forgot about that one before I left. We can scroll back up, and again, look away if you don't like my fast scroll, I apologize. And we go to this Part B, including inpatient. Now remember, this is for outpatient claims, so that's what, there you go, hospital Part B claims are. It's either that they are inpatient in a hospital or they are outpatient in a hospital. Now, inpatient in a hospital means their Part A benefits are exhausted. That's why it's called a Part B claim. And this will just get you through a lot of information regarding place of service when those certain circumstances apply. But remember, this will come in as part of the type of bill category. So hopefully that kind of guides you to that as well. And I'm not really sure what you were looking for within that Part B hospital stay, so I wasn't really sure where to go other than to give you the general information. Again, so put that back in chat if you do have that for me. Paper claims, again, we talked about these two different manual systems. I think they're great. They'll get you through what you need to get through. Remember, the list here will also help you in your electronic claims. It's just going to give you the overall list, so I think it's a great source. Electronic claims, these are some of the standard guides that we have available just to help you out. And they are available on our website. Again, all of this information, if you're looking at for any of this, if you want to get to any of it and you did download the PowerPoint, please feel free to select any of it on my PowerPoint. I just selected the standard guide to see if I can get this to open. And you'll see it will actually open directly from here. So you should have these links should you have the PowerPoint. Now, again, we do not PDF the PowerPoints for the reason that then you can get the links. But if not, yeah, we can send those out to everyone if anybody is interested in those. All right, so I gave you some resources. I gave you some general information. So here we're going to hit the hard part. Question and answers. Again, what I'm going to start with is the pre-submitted questions because those have built-in slides. So the correct place of service for telehealth, as I just stated, it is 2 for telehealth and 10 if telehealth is in the patient's home. Use modifiers 93 or FQ. Please don't skip your modifiers. I'm not sure where someone thought that that was okay, but please don't do that. I do want to remind everybody that there was some additional information just published on this, that there is going to be an extension for some telehealth stuff. We are not getting into that today. It does not change the place of service, but I would like to see if Leanne has anything she'd like to offer on that.
I do not have anything I want to offer, but as Tom said, that has just changed and we're working through what that means. Essentially what they've done is they've extended the telehealth flexibilities through September. So what you're currently doing is still in place. But please be on the lookout for future communications.
Thanks, Leanne. Again, if you guys, again, except for like the changes that we don't know about, but because it just happened. But otherwise, feel free to put some more questions back in chat if you have anything. This slide hopefully will get you what you need, though. Again, it's going to tell you all the basics that you need. What's the correct place of service for home healthcare G0178 and G0180? Now, this was an interesting question to me because G0178 is not a covered Medicare code. We wouldn't do it. If you build it, you still do want to use the correct place of service, and that is 12. The G0180 is a covered code, but you still would want it to be done, and the place of service 12, the patient's home. So it just depends. Someone asked regarding this one, is there certain circumstances that you can do with other things? There's always going to be circumstances, you guys. It's never going to be a cut and dry. Like for instance, does a patient live not in their own home or not in a private home, but do they live like in a in a nursing facility where it's actually domiciliary care? You could look that up as well. So I really would need a little bit more information as to what you're talking about. For the most part, though, that's not considered home health care when that is done. Home healthcare really does focus on place of service 12. Where can you locate a place of service list? The one that I actually like the best is the one that I just showed you, and it's out in that chapter 26. I think it's great. Now I'm going to show you another resource that is available on our website, and our website is wpsgha.com. It is a quick reference place of service list. I don't typically go out and kind of navigate my website for this. I know what I'm looking for. It's place of service. So if I just type place, it'll automatically pop up what I'm kind of going through. Here's the different ones that we have. This is the one we're looking for. And we can go through and read all the different places of service. Please note, you will see a light green and it's I'm on A, and it's saying, hey, this isn't applicable to you. Because remember, it's type of bill that is for Part A. Place of service would be Part B. Now don't get confused. On our website, Part A does not mean inpatient claims. Part A is used for anything billed on a UB04 or 837I. Doesn't matter that it's a Part B benefit, it's anything billed. 1500 or 837P, you need to be in the Part B section of our website. And you can see that automatically goes away because that's where place of service is applicable. You can just kind of scroll back again through these. We do have a little bit more information if you are interested in learning about the 10s and the other things too, so we want to make sure they're there. So let's go back up to 2 because that's the other side of that, telehealth in the patient's home, where the health services and health related are provided and received through telecommunication. The patient is not located in their home and receiving telehealth or health related services. Someone did ask me what that means and why they would not be located. Well, if I wasn't in my home, where else could I be? Anywhere. I could be in a hotel, right? So I'm still within the United States. I'm still within the service area. I'm still within whatever, but I'm not in my home setting. I'm in my hotel room. The door is shut. I can still get a service there. That's why it says other than the patient's home. So hopefully that kind of helped you out a little bit there. All right, let's jump back to that PowerPoint again. So again, if you want a more complete list, I really do recommend using one of those two. Oh, I did forget one thing on this list. If you're using our list, which gets on our website, and you forget, you can always come down to the bottom and it will reference you back to that section of the IOM. Now, again, this is the paper manual section or the paper claim form section. But what's great about it is it's got the complete list and you don't have to worry about trying to remember any of that. All right. The next question that we got in was, do procedure codes need to be billed on a UB04 for place of service 22? Again, a UB04 wouldn't use a place of service 22. They would use a type of bill which would identify outpatient, and I'm not really sure what you're talking about there. And do procedure codes need to be there? Yeah, in most cases for outpatient services, we need a procedure code. It's not like inpatient where we're paying based on prospective payment systems where sometimes the procedure codes aren't required. It's a little bit of a different circumstance. So please check out the type of bill information, but make sure that it is there. Again, they don't use the place of service code, and you would want to make sure it's an outpatient type of service. I'm guessing is what you're asking me, but I'm not entirely sure because again, they don't use that. Is it appropriate to bill an inpatient or observation ENN in place of service 22 instead of an office or outpatient ENN and place of service 11 when a provider sees a patient in the office and then sends them to the hospital for observation care? So the key thing is way down in the bottom. It says when a provider sees the patient in the office. This is place of service 11, not 22. Why? Because you saw them in the office and you sent them away from your office and you sent them for observation care, which is another outpatient care. So it's two completely separate encounters in terms of Medicare. The observation care would be billed separately. Now, if you said, hey, I had to do one evaluation and management because I continue to monitor them or something else, you still have to follow that. Now, when you're saying, okay, so I sent them for observation care and I'm going to use that as my evaluation and management code for the day, there are other circumstances that you can get into with that. And I'm not really sure exactly the circumstances that you were looking for. I'm going to stop and just see if Leanne has anything to add on that. But again, without the details, I'm not really sure where you're going with that one. So Leanne, anything?
I do not have anything to add on that.
Okay. So a little bit more to go back and forth with that one. If you have anything, please help me out understand what you're looking for there. Provider-based billing on a service for a professional claim. Again, for provider-based billing, the place of service is still where the patient is. For provider-based billing, the facilities don't use a place of service. So if you're doing if you're doing a true provider-based billing and you're billing the facility code, you're billing on a UBO4. That's what a provider-based is. So I'm not sure what you're doing. Now, if you're billing a professional service, you could use a 19 for an off-campus outpatient department, or you could use a 22 for an on-campus outpatient department. I wasn't really sure where you were going with this. Now, both of those, if there is a subject to the facility reduction, it would be subjected to that. The facility gets paid for the overhead expenses, all of that, not the individual provider. So when you look at the fee schedule, and we'll talk about that in a moment, you'll actually see a little hashtag or a pound sign on there, which is where we're going to go next. And so it does directly affect that. So part of this question was about that fee schedule. I think the easiest way to find the fee schedule for the professional side is actually to come to our website and to go to the topic center. On the topic center, just go to fees and reimbursement. Please make sure you're in the Part B, fees and reimbursement, because the Part A side does look different as they have different ways of paying, prospective payment systems, all of those types of things. So you want to make sure you're in the Part B one. You just pull up the fee schedule. Well, we're going to do the 2025 physician fee schedule, and you can see it right there on the top. You don't have to go anywhere. You can download this file. I'm going to do it in PDF, I find that easier, but you can do whichever way you want. What I was talking about is this little sign right here. It is, again, the number sign, the hashtag, whatever you want to call it. What this tells us is that this has got a reduction if it's performed in a facility setting. So we want to make sure we have all of that information. Remember, though, the facility itself will bill the observation care. So that's what comes in on the UBO4. Now, the actual, for the bed, the room, the board, all of that, the professional will bill the observation care for the actual nursing, or I'm sorry, the observation care codes for a professional service. So it is a little bit of a different understanding there. And the difference understanding is to make sure that you have the right place of service in there. Oop, I didn't mean to go back to that, sorry. Let's go back to this. All right. So when we're looking at this, again, you want to make sure you're using the correct off-campus department if it is an off-campus department, and not everyone is going to be in an off-campus department. Oh, whoa, what did I do? Wow. Okay. So this is the one that caused quite a few questions to come in. So I really do want to take just a few moments to talk about this. There was skilled nursing facility, and the difference in a skilled nursing facility and what that means. Okay, so there's two different things that go on. Place of service 31 is when the patient is in a skilled nursing facility, medically necessary, Part A stay. Now, why is that key? Because Medicare is still paying for that stay. But the Medicare benefit for a skilled nursing facility is only 100 days per benefit period. So after 100 days, Medicare stops paying. It's not that the medically necessary stay isn't there. It's not the patient doesn't meet that medical necessity or all the other criteria was met. It's just there's no more payment coming from Medicare. That is then what we call a Part B stay, which moves it to place of service 32. So obviously you can see this does mean that you do have to communicate directly with the skilled nursing facility to find out where that patient is within the stay. Now, place of service 31 and 32 are both billed with nursing facility codes. That's correct for like an evaluation of management. That doesn't change, okay? So we want to make sure that you are well aware of what is going on with this one. If you have any questions, let me know. But again, place of service 31, Medicare is paying, it's a Part A stay. Medicare is not paying is place of service 32. And a lot of times the only way to really determine that accurately is to ask the facility. Hey, is Medicare paying still? How long has this patient been inpatient with you? Has there been leave of absences? Are they on a leave of absence? Any of those types of questions. Now, a leave of absence simply means that today they're at home or today they were let go for a period of time. And by let go, I mean they're not staying in the facility tonight. And it could be something where they're actually going out back in to test and see if they're ready to go home for a longer period of time. Could be a holiday, it could be a funeral. There's a variety of reasons a leave of absence can be billed. The next question, is there a minimum amount of time if a provider works from home that we don't have to list the home address as a place of service? Example, works from home 2 days because they're sick, but does not regularly work from home. And this is also going to go through a provider enrollment question. And in the end, we're going to throw this one at you too, just to see if you have anything after I answer. But no, Medicare doesn't have a limited amount of time. It doesn't say if they don't do it on a regular basis. It does say if they work there at all, or if there's the potential to. Leanne, do you have anything to offer from the provider enrollment standpoint on that one?
No, that is absolutely correct. At some point there, right now, providers do not have to report their home address as their practice address. That could change in the future, but at this time, that's part of the flexibilities.
Right. So keep watching that one. Please keep watching that one. We don't really have a whole lot of to offer on that one, anything more than that. The next is a lab billing place of service. Well, the lab place of service is 81 for an independent lab, but it could be 19 or 22 if it's a hospital-based lab. I wasn't really sure what you meant by lab billing place of service. So if you need more than that, you'll have to help me understand where you got that from. Okay. When to use place of service 17, retail space. This is one that we don't find often for Medicare Part B, the part that we process. Now, I will tell you, DME does have this, right? They're actually fitting someone within a DME. They're doing some of the portions of the durable medical equipment. That is what it's used for. However, we also have seen this used for mass immunizers. And if you think about it, that makes sense. Where are they set up? They're set up in a retail space. Maybe they're set up in a strip mall today to get those immunizations out. So it's just where they set up. We've also seen this for counseling groups. So it is a mental health and it is a group counseling session, and they set up in a retail space and they provide counseling, which is billable to Medicare, depending on the type of mental health and the benefit categories for behavioral health that go with it. So we've seen retail space used for a variety of different things. Those are the two examples I can think of. So those are the ones that I would give you at this time. If you have a question on whether or not to be considered retail space and it's actually something that is going on and you're trying to get ready to build a claim, please call customer service. Let them help you through that. They'll be able to help you. They're going to tell you that, hey, I can't give you coding advice, but you can say, does Medicare consider retail space? And they'll tell you yes or no. For that code, for that procedure code, I guess I should say. Does Medicare consider place of service 17 for this procedure code? They'll tell you yes or no. Next one, the patient is an inpatient stay, but is taken to a physician's office to be seen. What is the correct place of service? The correct place of service still goes to the inpatient stay. It has to. The reason that this happens is because it's the patient status that's basing this on. When the Medicare system comes in, if you were to bill for office, which is an outpatient, it won't take it. You could put 21, 22, etc., or 21, 31, etc., but it's still patient stay. 12, what is the required place of service for remote patient monitoring, which is chronic care management, according to the question? And I listed them here. It's 10, 11, or 2, just depending on the situation. Telehealth in the patient's home, 11, or 2 if it's other than the patient's home. That brings us to the live question and answer session. So let's see what you guys have for me.
Hi, Tom. We do have a few questions in the chat. Let me scroll back up to that. It looks like our first question is, under special considerations for place of service 02 and 10, it states to append 93 modifier for audio only and 95 modifier for video. Your slide only mentions modifier 93. Is 95 still applicable for video? And if so, are there any CPT codes excluded from this rule?
There are no CPT codes excluded from the rule. I apologize. I did not mean to leave that off on my slide. Yeah, you could use either one of those two. I guess when I looked at it, I didn't include that. So that is my fault. But yeah, definitely use whichever one is most applicable for you. So I was just trying to get back to that section here. So
All right,
go
great.
ahead. Next question.
All right. And our next question, it looks like, is, do you have guidelines on what is considered an outpatient department of the hospital?
So the outpatient department, the guideline is actually from the enrollment status. And what happens is when a hospital enrolls, it's how they set that up. So what they look for is, one, is it within a hospital? Start there. If it's not, then it's obviously not an outpatient. Two, is it wholly owned or operated off campus? Now, again, off campus has a certain defined foot amount, and I don't remember exactly how far it is, but that would make it off campus. And again, it just means that it's not in the same building. It's not physically connected to or touching, like in a parking lot, for instance. So it's not that different. And in terms of outpatient hospital, what else are we looking for? Is the space separately leased or separately operated? And maybe the better way of saying that is and, separately leased and separately operated. So for instance, there's a building across the street, and this is our outpatient center. But within that building, an ambulatory surgery center separately leases, has their own separate everything, but it's located physically within that outpatient hospital center. So the outpatient hospital does their outpatient PT, OT, SLP from there, physical therapy, occupational therapy, speech language, all of that. Then the ambulatory surgery center does their services from there as well. The difference is the ambulatory surgery center is owned and operated independently. They pay for their own staffing, they pay for their own supplies, they pay for their own things like that. Now, if you said, hey, they don't pay their own electricity, but they lease this space and that's part of that's part of what comes with that lease space, awesome. That's still paying for it separately, even though it's not a direct payment. So when you're really looking at that, hopefully that answers your question. It is still, what we're looking at is really that definition of how are they registered with us and how do they control with Medicare. Again, we're going to go back to the end from a provider enrollment perspective and see if she has anything to offer.
No, that is correct. The one thing that I will add, though, is that the distance is 250 yards, but within 35 miles. So there's a decent amount of space there. And it does
Thank
come
you.
down to enrollment.
I knew that Liam would know that distance. I don't remember that off the top of my head. So next question, if please.
All right, our next question is, if the provider sees the patient in office and sends the patient to the hospital, is managing the observation, admit, and care from the office, can he or she bill the observation code and place of service if they do not go to the hospital to see the patient?
Wow. So for a place of service question, that's not really to build the observation code isn't that's observation care question. That's not a place of service question. So I understand where the provider is, understand where the patient is. I can tell you that yes, you would use the patient's patient service code, the E&M code that you would use should you be able to bill for that would be patient status based. So if they were in observation care, you would want to build that type of code. If they were not in observation care and they were inpatient, you would want to build that type of code. Leanne, do you have anything to offer though on whether or not that type of management needs to occur face-to-face or not face-to-face? I don't know, and I'd have to research that.
That is one I would have to look at as well. But what you've stated about the types of code in that place of service is correct.
So remember, when we're talking about place of service, we're not talking about whether or not the code is payable in what you're describing there. If you do want that answered, you do have to email that one in. That's not part of the place of service by definition. What would be a place of service code? The answer that we gave you for place of service does apply. So go ahead to the next question, please.
All right. Next question. When you said UBO4 is not used when a patient is observation, did they misunderstand? They always believe UBO4 for observation status for the hospital billing side and professional billing on the 1500 form.
Oh, no, that's correct. I apologize. What I meant was the professional with the place of service code, because remember, this is about place of service code. The UBO4 doesn't use a place of service code. So you would still use observation code, which would be hospital outpatient versus hospital inpatient. So 12X versus one, so hopefully we get all that stuff down, make sure you have the right observation code. And yes, you would still bill that, and that's all fine. So yes, your actual observation care professional component would come in on the 1500 and would have to have the correct place of service. Because it's based on the patient status, we want to make sure we're using the correct place of service there.
All right. And our next question. An inpatient came over to our office and then was sent back to the hospital where they remain an inpatient. Do we bill office E&M codes 99212 to 99205 with place of service 21?
So actually, no, this is one of the interesting place of service caveats. 21 is for inpatient, and you do have to bill a hospital evaluation and management code based on the fact that they were inpatient hospital at the time. If you bill an office code, even though it was performed in the office, and I understand that, but if you bill one of those office, the 99212s to 205s, etc., if you bill anything outpatient, those office codes, it's not going to go through. So please make sure that you're billing the inpatient code, the inpatient evaluation and management code for that service. Yes, 21 is the correct place of service. It's just a kind of a caveat. Our system has to match the 21 to the inpatient code. It can't take an outpatient code with a 21. So.
All right, and it looks like we have just a few more. To clarify, for HHG0180, the physician signs the order in their office, but we should bill using place of service 12 for the patient's home?
Oh, no. Okay. So yeah, the signed order. Okay, let me start over. How do the physicians see the patient that day if they're signing the order, if they're getting it all ready? Now, if they're just finishing documentation portions of it, that's fine. If they're reviewing documentation, they're ordering it based on that, that's a different situation. So I guess when I say place of service home, how are they seeing the patient that day? Because the patient could be in their home, right? You could be seeing them via telehealth, communication, patient's home, all of that. The patient could actually be seeing them in their home. The patient could also be seeing them in their office, and which would be place of service 11. So I guess when you said home health, I assumed that they were seeing them in the patient's home and they were doing that information there. So I apologize if I answered that incorrectly. Please make sure it's reflective of where the patient was seen.
All right, the next one, Tom. This says, can you repeat where to find the FFS, I believe they mean fee for service download that you showed?
Okay, fee for service download. I'm not sure if you want this one or if you were looking at the physician fee schedule, which is this one, which is going to give you the facility pricing. So the Medicare claims processing manual, will get started there. Oh, I guess I do have to go back here. It's on the CMS website, so I'll start way back out. Sorry, there we go. So cms.gov, we're going to go to Medicare. Once we're in Medicare, we want to go to regulations and guidance. A lot of people go to coverage. It's not there. It's in regulations and guidance. Then you're going to go to the word manuals. Okay. And then once you're in manuals, look to the left side. You'll see internet only manuals. That's the big long list. There's all the different manuals. This particular one is in 100-04. And again, there's a variety of different manuals that will be applicable. If you're looking for some information on OPPS, you'll want Chapter 4. If you want to scroll down, type of bill information, Chapter 25. Chapter 26 is where I actually find the place of service information. And then I just kind of read through 10.5. And then we can go through all those, again, ending with our starting with some base information and then the charts and all those different things, and then finally ending with the special circumstances. Now, if you're looking for the physician fee schedule to be able to tell whether or not it had the little hashtag or the little pound sign, You'll start with WPS website, and that's WPSJHA.com. Topic Center, fees and reimbursement. Please make sure that you're on one of the two Part B sections. So if you want Indiana and Michigan, you want this one. Iowa, Kansas, Missouri, Nebraska, you want this one. J5, Iowa, Kansas, Missouri, Nebraska. J8, Indiana and Michigan. And then once you're there, now this is organized, but I don't really like to look through the full list down below. I just like to go right to the top, and I just use this 2025 fee schedule because that's what we're looking at. Then we can go through, you can download a full Excel file. I usually do the PDFs. The reason that I do the PDFs, and again, use the appropriate area, it'll tell you what you're looking for there. The reason I do the PDFs is because they open right away and I don't actually have to download and then open a file and go through all that. But you can do whatever you want to do. What you're looking for here is this little pound sign or hashtag. It just means that you get a lower price when done in a facility. Here would be an exact example of that, and you can see there's quite a substantial difference for 0071T procedure code there. Okay, next.
All right. Our next question is, if a test is performed at a hospital outpatient today and tomorrow the provider does the interpretation and report at his office, what place of service for the I&R at the provider's office?
So if you're going to bill that separately, which would be a modifier 26 for the professional component interpretation, right? Then that would be the provider's office, place of service 11. Now, I can't advise you if you're going to globally bill it, then you'll have to pick the place of service, but it's going to be the inpatient. It's going to be the hospital outpatient place of service. The reason that some people, get a little thing like that is I said, well, we only ever bill these this way, or we only ever do this way. Well, okay, I understand your system is set up that way, and that's what you're going to have to do. But remember, the 21 versus the 11, one will get more money than the other, so, or may potentially. So.
All right. And next question, what place of service would be used when the provider performs a radiology read in a different locality to where the x-ray was taken?
Can you tell me where the provider was with this one? Because it could be an office setting place of service. If they're in an office, it could be, which could incorporate their home as well, if that's, one of the places that they do that, because a lot of providers do have that type of situation set up where they have like a home office set up. Some providers will do it when they're on rounds, so they're in between seeing patients on rounds in a hospital. So place of service 21 could also be the correct place of service for that. I don't really know what you're getting, where I need to be with that one. So it's really dependent on where the provider is what I'm trying to say there.
And this one might be a follow-up, Tom, from the same person. Would we still use the location where the patient was located?
No, not if it's a professional of an x-ray or something like that, MRI, etc., because the reading doesn't necessarily reflect where the patient was located. It should reflect where the provider did the reading. So it's going to be different than like a home health where the patient should be located, or like an inpatient. Always that professional component would be reflective of where the actual provider was versus the patient, because that provider may not be seeing that patient at all.
All right. And the next one, if a patient resides in a dementia facility that does not bill Medicare and you provide therapy for them, what place of service would you want to use? This would be for an outpatient physical therapy clinic billing on an 1500. The clinic does not rent any space or own any of the facility.
I have to look that one up again. I'm sorry. I know it's an outpatient domiciliary. It's going to be the same one for the skilled nursing facility, which may be an easier way for me to find it. Off campus. No. Let's do this.
Tom, I think it's 31 or 32. I have to look.
Thanks. I think it's 31 or 32. I was just trying to get to the right one. Okay, so in this case, you're going to use 32 for this one. And the reason for that is by definition, 32 would also be applicable for anything that is considered a nursing facility. By the way, the type of facility you're describing is considered a nursing facility. However, it's not registered with Medicare. They're not getting paid by Medicare, which then falls into, residential care. residents, skilled care, and related services for rehab, injury, etc. on a regular basis, health care related services, custodial care to the patient. So it is going to fall into that 32 category. Hopefully that gives you what you need there.
All right, and it does not look like we have any additional questions at this time.
Okay. So a couple of things to keep in mind. If you have specific coding questions and you want to know if our system accepts things in a certain way, I would encourage you to come to the contact us, do two things, one of two things. You're either going to email us right here and they'll walk you through the form. Please keep in mind, you cannot put any patient identifying information. PII, you can't put any PHI in this, but you could email those in this way. Also, if you use secure messaging, and those of you that are not familiar with that, that would mean you logged into the portal account up here, and then you went through and you selected secure messaging there. You could at that point send it in that way as well. It's going to go to customer service. They do have 45 business days to respond to all inquiries, but that's probably the best way to do that. Now keep in mind when you're looking for those coding type questions, what you're not going to ask for is what code do I use, blah, 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 because we can't give you coding advice in that manner. Now, again, the type of questions you asked today were great, but if you have very specifics, they're not going to be able to help you. They can always tell you if our system allows blank, blank, blank procedure code and blank, blank, blank place of service, or blank, blank, blank type of bill. They can do that for you. Now, they may guide you to other resources to help you out because they are told that if it is available in a self-service tool, they have to use that. So I really want to encourage you guys to take advantage of that. If you need an immediate answer, you can always contact customer service. If you're not getting what you need or they're not understanding, you can ask them to tier it up and they may be able to help you out with that. A couple more pre-submitted questions that I just want to run through really quick. Someone asked for place of service 34. I don't have a whole lot to offer on that other than what the definition is because I wasn't really sure where you were going with it. Place of service 34 is hospice. Now keep in mind, this is a facility. This is not a patient's home. The patient didn't go home for hospice. It's a hospice facility. It's also not a hospital in which the patient is in hospice. That is still a hospital. So we would have to use the correct place of service code with that. So I wasn't really sure what you were looking for with 34, but I thought I would just throw that in there in case you needed more information. Another question that came in is, can one place of service be billed under different tax IDs and NPIs? Example, provider A works at the hospital with an established TIN and NPI for the hospital. Can the provider group with that provider A is employed by bill with place of service bill for the same location under the employer tax ID and TIN? Yeah, place of service can be billed in a variety of different ways, and yes, they could be different. What if a provider is standing in the hospital but is doing patient care through telehealth? Like, I understand they're in the hospital, but telehealth has a different place of service. So yes, they could be different. I'm not really sure where you were going with that or what you needed, so hopefully that is correct. The last one was, teaching physicians in graduate medical education that are set up as patient care experiences, can they bill 19 or 22 or both? And the answer is yes, they can bill both. Really depends, again, where is the hospital, what is the facility, all those types of things. But also, if it's a teaching physician, I didn't want to get into a whole lot of detail with this. Please be sure you follow the Medicare Claims Processing Manual. Make sure you're in Chapter 12, which is physician, non-physician practitioners, and you follow everything in section 100 for teaching physicians. So without going into any of the teaching physician criteria, that's my answer for that one. One last chance. Any questions?
Tom, we do not have any additional questions.
Okay, let me get back down to my proper slide. I will let you know that I will take questions for the next 7 days, and you can email those into us. This is our email address, wps.gha.education@wpsic.com. Keep in mind, I won't be able to do any of the specific claim questions like, does this procedure code and this place of service work together in your system? That is a customer service question. That's not something we can look up. Please incorporate POS, or place of service Q&A, and we'll get those answered for you. All right. Certificate. Right after this event ends, we're going to email you a certificate. The certificate will come out in the email. It's going to say, hey, take this survey, but a little bit further down, it's going to have contact hours. You can see it highlighted here in the bottom box. It's got a red box around it. The certificate is what you use for CEUs. We cannot guarantee that any governing body will issue you CEUs. Instead, we issue you contact hours. And again, it's worth 1 contact hour. It will have all that information. If you were a dial-in person, in other words, you called in and you did not join via the computer, you will need to use the previously given email address and let us know the phone number with area code that you dialed in from, and then we'll issue you a manual certificate. But that is a lot more work and it could take a little bit more time. It could take up to a week for me to process that out and get everything guaranteed and ready to go on that. All right. Please take my survey, everybody. I'm going to have Ashley throw in a link to it. But as a reminder, there's going to be a couple of different ways to do it. You can use that link right away. You can also wait. When we close out the webinar, you're going to get a link, or you're going to get a pop-up box. The pop-up box is going to look like what's on the bottom of this slide, that external site. It isn't spamware. It isn't malicious. It's nothing like that. It really is asking us to take our survey. Also, if you're listening via Encore, you're going to have another box that's going to appear. It's going to look like online survey, the top box up here, and you can take it that way too. So we really want the survey. What are we looking for? Everything we can get. The good, the bad, and the ugly. What did I do well? What could have been done better? What was my presentation useful? Were the websites that I showed useful? Did I get you what you needed? I want all of it. I need to know that in order to help in the future when we build additional webinars, especially the Q&A ones, because we aren't really ever sure if we're hitting what you need. Again, we try to do the best we can with what we give you, especially the resources and stuff like that. Now, you can also add suggestions not related to place of service for future education, and we really would like to hear those as well. So I really encourage you to take time to take that survey. That's it, y'all. Thanks for attending and listening today. We hope that you got the information that you needed. Remember to take the survey and again, apply the good, the bad, the ugly, all the information you got there for me, but also include any topics. Sign up for some additional webinars, check that out. Make sure that you are keeping track. We do typically post webinars on Monday, and then the e-news will come out on Wednesday for the new ones. On behalf of myself, Leanne, Ashley, all of Provider Outreach Education, and WPS, thanks for your participation. We look forward to your survey comments, and we hope that you'll join us in the future. You may now disconnect.